Okay, awesome. So with that said, we want to go into the history of racial health inequities. This is just a very quick snapshot, but there has been years of recorded and told stories of how Black and Brown communities have been receiving the short end of the stick of a lot of different situations. So just going to go through a few different scenarios and bring it back to modern day. So in 1793, there was a yellow fever epidemic in Philadelphia. Dr. Benjamin Rush, he petitioned that Black leaders assist with digging graves and trash collectors and being housekeepers, but Dr. Rush did that because he believed that Black people were immune to yellow fever during the time. So while everyone else were basically being quarantined, Black people at the time in Philadelphia were forced to sign up for these jobs, and they ended up actually 5,000 people died from the yellow fever outbreak, and 10% of them were Black, despite making only 6% of Philadelphia's population. And just hearing some of that statistic is kind of comparable to Black people as a whole. In the United States, we make about 12.3% of the population, but when you hear of diabetes and cardiovascular disease, we pretty much come up on top as one of the top race that maybe deal with the complications of some of those diseases. So that happened in 1793. Then the infamous Tuskegee syphilis study, that's probably one of the most repeated studies that everyone talks about when it comes to even getting the vaccine. I know that's a conversation for another day, but as the hospitals were going into the communities and saying, you need to get the vaccine and you need to make sure that you get your 2 shots in time, a lot of people came back and said, like, no, you don't remember the Tuskegee syphilis study, where a lot of people, so in 1932, if you're not aware of that study, 600 men were told that they were going to be treated for bad blood. And the participants were not made aware of their diagnosis. So they pretty much injected them with syphilis just to kind of see what will happen to them. So they were used as lab rats, and 2/3 of the participants had syphilis. They were never treated even after treatment became available. So they pretty much tried to use them as lab rats and figure out what happens when the human body has syphilis, what does it do to the person. And even after the treatment was made available, they were not told that they ever had syphilis, nor were they provided treatment. Years later, the US government did give a $9 million settlement to the families, but that, in my opinion, that does not make a difference, because they've already lost their lives. They've dealt with the symptoms of syphilis, and it's just really unfortunate that this happened. But again, this is just one of many studies. There's a book called Medical Apartheid by Harriet A. Washington that really goes through every single racial inequity that has happened since slavery. So even with some of the gynecological surgeries that have been developed, they were practiced on women slaves back in the day, just to kind of test it out. And then once he perfected it, Dr. Marion Sims, he perfected it and practiced it on white women, but never gave the Black women slaves any anesthesia. So he pretty much practiced on them and perfected it, and then said it was widely available for white women. So again, those are just some of the examples that has happened throughout the years as to why there can be a little hesitation when it comes to going to the doctor. So and another thing I wanted to highlight is a study that was done that shows that a lot of healthcare professionals, when it comes to pain medication, so if a Black person goes into the doctor, goes to the doctor and say that, hey, I've been having back pain, or, you know, whatever pain that they're having, whether it's maybe you're dealing with fibroid pain, whatever it is, a lot of healthcare professionals really ignored those cries for help and the need to get a stronger pain medication. But then when a white person or another person of primarily white, because that's what the study was for, but they realized that they actually were not as hesitant to give them the pain medication. So in a survey of nurses and nursing students, many believe that Black people have a high-end pain threshold. So a lower likelihood of Black patients to be prescribed opiates is the largest impact of racial bias in pain medication. So again, that's just something to keep in mind, even as you're going into the doctor, being a huge advocate, not only for yourself, but for your loved ones, because these biases do stay true for today, even for our current healthcare providers, and just being able to advocate and understanding some of the data behind it. So to modern day with COVID-19 pandemic, where we've seen some areas, they may have a high number of testing sites, and it's much easier to get tested in certain neighborhoods. But then when you go to, let's say, Pine Hills, or, you know, some areas that is predominantly Black, is much difficult, or maybe there's longer waiting lines. Because I remember even trying to get tested, at one point, some of my friends were asking me, where do you get tested? Where do you get tested? And I was telling them Barker Park. I think that's the name of that park off of Colonial near the fairgrounds. And every single day, it's a long line, just waiting to get tested. You don't even know if you have COVID. And then, but then there's some areas where they actually have mobile testing buses that's just, you know, going around and making it very easy and very accessible to get tested. So with all of that being said, we're still technically still in the pandemic, but the cases have been going down, and a lot of people are a bit more privy to more better hygiene to make sure that they don't have the COVID-19. But when it comes to Black and Brown communities, we actually saw a lot more of us dying or having complications from COVID-19. And it's not just because they're Black or brown, but there's a deeper reasoning as to why Black and brown communities are typically impacted the hardest when it comes to some of these diseases. And just to compare, in Orlando, Black and brown individuals in Orlando and other cities were dying. I should put were dying, because now again is decreasing a little bit, but at a much higher rate than whites, 3.5 times higher. So it's beyond healthcare access. As I mentioned early on, you know, a lot of times when we go to the doctor, it's focused on individual behaviors, and okay, if you want to lose weight, then you just have to go exercise. But then not thinking, well, where do I exercise? Is my neighborhood safe enough for me to even take a walk? Do I even have the financial capability to pay for a gym? A lot of things that we kind of just tell others to do, we don't realize we're speaking from a place of privilege. So a lot of times we have to check ourselves and figure out, how do we make this a little bit more accessible, or how do we customize some of this medical advice to make sure that that person is able to abide by it. So factors that affect health. So only 20% of healthcare, access to healthcare impacts your overall health, and 80% can be tied to socioeconomic factors, your physical environment, and your health behaviors. So a lot of that has really, you can go to the doctor every single day and every time that, you know, for your physicals and all of that, but look how big the chunk is for socioeconomic factors. So that's your education, that's your job status, your family and social support. And that's important. That community care piece is very valuable. Your income, community safety, and 50% of this can be traced back to your zip code, because there are certain zip codes where the quality of life increases a little bit more, and even the length of how long someone can live can be compared zip code to zip code, especially in the Orlando area. So again, only 20% of that is access to care and the quality of care. So when we're implementing these implicit bias trainings and all of that into the hospital systems, that's only catering to that 20%. And what we really should be focused on are the 80%, the socioeconomic factors, the physical environment, and the health behaviors. So with that said, social determinants of health, has anyone heard of that phrase before? Yes, no, maybe. Okay. So Healthy People 2020 actually needs to be updated to 2030, but it defines SDOH, social determinants of health, as conditions in the environments in which people live, learn, work, play, worship, and age that affect their wide range of health. So they break it down into 6 subcategories. So there's economic stability, that includes your debt, your medical bills, your support there, your neighborhood and physical environment, thinking about where you live, where you work, the playgrounds. Do you have sidewalks? At night, do you have enough lighting in your area? Education, so literacy, language, vocational training, higher education, that all ties into the quality of your health as well. Food, access to healthy options. There's environmental racism as well. I'm not going to get too much in the weeds with politics, but there are some redlining and there's certain areas. I mean, even as you're driving down on Colonial, where you're going from one area in Orlando to another, where you might see there's an area where it's filled with Whole Foods and, you know, the very healthier options, but then you go down to the West Side or, you know, certain areas in Central Florida where you might see there's a lot more McDonald's, a lot more Popeyes, a lot more of those fast food options. And that also makes it a little bit difficult to even access healthier options, because where are you going to find it? In those areas, you would consider food swamps. So the other subcategory is community and social context. So that includes social integration, those support systems, community engagement. And then the healthcare system is the last bucket, where it focuses more on provider availability, health coverage. And when we're talking about provider availability, we're even thinking about mental health therapists. There's a shortage of that, especially right now, and with almost 2 years being stuck in the house, a lot of mental health kind of rises to the top as one of the top health priorities right now, especially in Central Florida. And that's something that is very difficult to address when there's not as many therapists to sign up for and to be able to see. So again, those are just some of those subcategories, and that encompasses the social determinants of health. Any questions about that or any additional thoughts?
I didn't have additional thoughts, but I was putting in the chat that UCF's Urban and Regional Planning Program actually hosts a series of lectures each fall that address these things that you're discussing. So if anyone's interested, there is an archive of those lectures, and I think the live events, you can register each fall. They have free food, you know, that's always a good thing. But yeah, those things are incredibly, incredibly important, and they're so integrated that, you know, the slide I think you had one slide before showing the body parts with the 10% built environment and like 30% other social determinants, those are really interconnected, right?
Mm-hmm.
Because your built environment determines those other things existing.
Definitely. And I wish I added a slide where I can compare, one zip code to another, but the differences are drastically, it's scary even to see how something that is determined by, how much money you make and all of these things, and then just being in a certain neighborhood that can increase your, the amount of years that you live by 5, 6, 7 years. So that makes a huge difference.
Yeah, I think if you want to think for Central Florida, an easy one I can think of is Eatonville, Winter Park. So I live
Mhm.
across the street from Whole Foods in Winter Park, right? Eatonville's literally 1 block away from my house. And, the sidewalks, they're just not the same.
Not
Whole
this.
Foods does
Mhm.
not deliver to Eatonville, even though it's on the same block as the neighborhood. They only deliver up to Winter Park's borders. So just things like that. You're in the same area, quite literally in the same area, and
Right.
drastically different service.
Yeah, so we can see it day by day how even in our own lives, in the lives of our loved ones, how some of these things impact our lives. Um, so biological weathering. Not sure if you all are familiar with this term, but weathering is driven by the cumulative impact of repeated exposures to psychosocial, physical, and chemical stressors. So that's also another reason why a lot of times Black and Brown communities, they may be impacted by some of these diseases and illnesses a little bit more than our white counterparts. And it's because of some of that stress. We've heard of generational trauma and how that has been, it can be transferred to another generation if you don't deal with it yourself. So there's just a lot of different things that impact our health, and the biological weathering is one. And compared to whites, Blacks experience higher levels of stressors, greater clustering of stressors, and probably greater duration and intensity of stressors. Because even I read an article the other day about the Great Resignation and how people are leaving their jobs because of maybe just some of them just don't want to go back in the office or whatever the reason may be. And some of the people that they were getting quotes from, they said that, what, I'm actually happy I don't have to go back in the office because I don't have to deal with the microaggressions and all of that. And I know that sometimes that plays a part even to our overall health and even our experience in the workplace, having to deal with that. And that also plays a part into the biological weathering as well. So imagine, you're dealing with the weathering, you're dealing with, your personal day to day, the stressors of just having to pay bills, and maybe you have kids, maybe you have grandkids. And then on top of that, there are just all these things that are outside of our control where we just kind of have to push through and just deal with while maintaining our sanity. So again, that all impacts our health. So when it comes to, there's a lot of talk right now about health equity and what that means for our communities. With equality, as you see in the first image, you see that, they all have the same amount of crates underneath them, but the third person, they cannot see the game at all. And that's equality. So assuming that everyone benefits from the same supports, where you provide maybe a grant application or whatever it may be, but then some people may not have access to it, or some of the certifications of being a minority owned business in the area. So just making sure that some of these, like, yes, there's equal access to it, but what does that really look like from person to person? So with equity, everyone gets the support they need. And this is the concept of affirmative action, thus producing equity. So everyone is able to kind of see through, well, over the gate, and they're able to watch the game. But then with justice, and that's really what we want to achieve here, is all three can see the game without any support, any accommodations, because the cause of the inequity was addressed. So the cause of the reason why they couldn't equally see is because it was a wooden fence. So they replaced that fence and put one of those chain hole fence. So now everyone is able to see it, and no one needs that additional support from someone else. So this is just a visual of how words do matter. And when we're saying health equity and health justice, we want to make sure that we kind of use the right terms when speaking about some of these things. So what can we do? So understanding that you all work in the government, here are some of the things that I would challenge you all to kind of think about. One thing is maybe reevaluating current talent selection requirements. A lot of times, some people are not, maybe they do not have the master's degree, but they maybe have the experience, or they have, different qualifications that may make them a better choice than someone else. Even with some parents, I know in 2022, a lot more employers are being a little bit more gentle about, piercings or maybe visible tattoos and things like that, because you lose a lot of great talent with coming into the interview with some of those biases in mind, but reevaluating some of those current talent selection requirements. The second one, which I think is probably the most important, especially in the spaces that you hold, is increasing engagement with trusted community and faith-based organizations and institutions that have relationships with local communities. I want to emphasize on this one is because a lot of times as organizations, we try to go into a space and say, like, you know what, this is our expertise. We want to be able to provide this service, but not really doing a full scape, a full glance of the landscape, and realizing that there's already organizations that have boots on the ground and already doing some of that work. So instead of duplicating that work, a lot of times it's really just doing some of that preliminary research and figuring out which organizations that are already doing that work, and then working alongside with them. And a lot of times I call out some of our grant partners and saying, like, okay, are you really the one to implement this program, or can you work with so-and-so? They're already doing some of this diabetes work, and you can just come in and provide your expertise instead of creating a whole new program. So again, just challenging you all to kind of think on some of the initiatives that you want to do, some of the community engagement work that you want to do. You don't necessarily have to start from the ground up or ground zero, but then just identifying some other organizations that's already out doing the work and then working alongside with them. And then the third piece is reassessing current policies that create barriers for community members and advocating for policies that can help address systemic racism. So again, don't want to go too into politics, but last night, I believe the abortion bill just passed with our lawmakers here in Florida. So that I think people, even if you're raped or whatever the situation is, you only have 15 weeks to address that. So again, just some of these things that can be a barrier for someone who may not have access to the doctor. There's just a lot of privilege there to kind of know if you're pregnant or if you're not, whatever it is. But again, that's just an example of how we, in the spaces that we hold, how we can be an advocate for some of these policies that are being passed. Right now, they're in session. But again, even some of the policies that you may have at the workplace, how can you show up and advocate for some of the policies that may not make sense anymore? That may be a little bit outdated, and how can you show up in the workspace and challenge some of those thoughts? So last but not least, what else can we do? So I want to open up the floor and just hear you all's thoughts on how do we achieve health justice in this space, especially in the spaces that you hold as government leaders.
2 points quickly. You've already commented. It was really insightful, your description of equality, equity, and justice. I tell you, that's going to stick with me for quite a while. It really opened my eyes to those concepts. We see those words, but that visual really clarified our need to really look for justice. And what else can we do to try to institute things that provide for justice? It started, with the Black Lives Matters movement. Well, it started many years ago, but it really was heightened where many people came on board that were not, of people of color. They began to see these things. Unfortunately, we have an initiative that tries to prevent teaching of race equity and those historical facts that have been hidden over the years. You know, they're telling a story, but it's not the correct story. So people have a false perception of what happened and why change needs to occur. But when you were talking about health, I thought it was really insightful that the implicit bias and the unconscious association leading to really the negative perceptions of things. I like when you talked about systemic, and I'll move quickly because I know other people want to comment, but systemic as it relates to healthy and organic food. You know, healthy and organic food is generally more costly. So that's the situation that we need to address. And people that are challenged socioeconomic, they have economic challenges, many times they can't afford it. So even if it's made available, I like Jaleesa's situation that the food was, they just won't deliver it, and they're kind of in the same area. But people living in an apartment they don't even have a parcel of land to grow food. So we have lots of things to do. And you've opened our eyes to some things we need to do, but there are solutions. You mentioned the Rio Grande Garden Project or whatever's happening there in downtown. So things can be done. So I really appreciate the information today, but we have a lot of work to do.
We do, and it's a collective effort. So I don't want you all to feel like it's just pressure on you. But one thing I do want to add is being mindful of even the language that we use when talking about healthy foods. A lot of times, the dominant culture has taught us now that kale is healthier and all these things, and then making us feel like our cultural foods are not healthy when they are. It's really just moderation in how you're seasoning your food. A lot of times, yes, you might not have access to kale or fresh carrots or whatever, but even me as a Haitian American, a lot of the food that is culturally relevant to us, I look at it differently now, and I'm like, you know what, this is pretty healthy. I don't know why we're now consumed with this diet culture and telling us that a lot of the food that we eat is not healthy. I would encourage you all to look at there's this organization called Eat Well Exchange, and they do a really great job. They have a campaign where they focus on collard greens are just as healthy as kale. It is. It's really just how we season it, what we put in it. We really have to be mindful, again, because we don't want to feed into the dominant culture and satisfy them for trying to change, whitewash some of the way we live, because there's nothing wrong with our culture. There's nothing wrong with our culture. I think it's just moderation and just doing some changes here and there. But let me just drop down the chat. Any other thoughts on that?
Rebecca, I just wanted to get confirmation. Would it be appropriate to cite BlackHealthCommission if someone wanted to use the graphic from your presentation, the equity, equality, justice one?
It wouldn't be fair because I did not create it. So I can send an email to you with the graphic.
Okay, so I sent the graphic in the a screenshot.
Okay.
So
yeah,
if it's available online, then I guess we can find the source elsewhere. Thank you.
Mm-hmm. Yep, of course. Yep. So if there's no additional thoughts on that, go ahead.
I have just a comment, Rebecca. Thank you so much. I joined a little late, but I certainly got the bulk of what you've shared, which is extremely enlightening. I appreciate the section where you say kind of what can we do? And I'm just thinking out loud here in the context of Orange County government. We have a cooperative extension that does a lot of research and community education. And one of the things I think we should do more of is taking that information out into the various communities that are impacted by this inequity that you outlined for us. And so kind of extending that reach beyond having the community come in and maybe being more intentional about the outreach to the neighborhoods and communities who could benefit from, additional insight and education and access to information relative to health and health outcomes. So just a thought in response to your question about what can we do?
Yeah, and honestly, we're not going to figure out the solutions today. It's going to take a lot of time, a lot of brainstorming to really figure out. And also, I would even challenge you all to even think about the different sectors in, you know, this area, and how we can combine, how we can work with the Advent Health, how we can work with these nonprofits that are doing the work, and see how we can all do it together. Because I think sometimes I even call out my leaders at Advent Health sometimes, and I'm like, we are not the end all be all. Like, I think we try to bully our way into communities sometimes, and sometimes it's just okay to, you know, let a smaller organization kind of lead, and then maybe we come in the back end and provide that funding, because that's what Advent Health does. We have the funding, we have some of the resources, but we as Advent Health doesn't have to be in the forefront of a lot of these conversations. So again, just want to challenge you all. Maybe there's things that maybe you all are working on, and maybe reaching out to another organization that's already doing some of that work. And that honestly makes it easy on you, because you're not learning as you're building it, but you're actually tapping into someone who's an expert in that space. Yep. So last but not least, here's my contact information if you all would like to connect. Again, I wear many hats. I'm program manager at Advent Health. We do a lot of the grant opportunities and sponsorships opportunities for nonprofit organizations here in the Central Florida area. We're also doing the community health needs assessment right now, but also I am the founder and executive director of BlackHealthCommission. I'd love for you all to come out at the Black Joy Festival. It's such a good time, intergenerational activities where, you know, grandma can come out, the babies can come out. There's just all different types of activities for everyone to enjoy and really center joy that day. So.
Awesome, Rebecca.
Yep.
Thank you. The voice you heard prior to mine was Carla Bell Johnson, who is our president, who has joined us. So Carla, thank you. That I always love to see our young African-American women doing wonderful things in the community. And so thank you so much for the information you have shared. I was just sitting here writing myself another note of, wouldn't it be great if we had a map or used our GIS skills to create maps of community gardens that could be made available very easily as a resource for.
I actually have that map. I made it.
Do
in
you?
school.
You have one?
Yeah, I have to see if I can find it, but I did make that as my project during grad school at UCF.
All right. Well, see, ask and you shall receive. And so, Jaleesa, we're going to be looking, because that would be a wonderful resource to make available to some of our communities that may be in an economic situation that does not allow for shopping at the Publix and the Whole Foods and even the Walmarts and some of the fresh vegetables and organic items that they have. So that is absolutely phenomenal. And she has put in the chat the date for the Black Joy Festival, which is Saturday, August 27th at Blue Jacket Park. And so we will make note of that, and hopefully we'll be able to help share that information as that date approaches, and encourage our members and persons in our respective organizations to attend that event as a means of reaching out and celebrating with the community. Seeing no other questions or concerns, it is 1 o'clock. And so in the interest of time, I will say thank you. Thank you, Carla. I'm glad you were able to join us today. Thank you to all of our members and friends who have joined us, and we will do this again, same date next month in March, and we look forward to seeing you and welcoming you to our March program. Have a good day, everyone.
Have a good one. Bye.
Thank you, Rebecca.
You're welcome. Have a good one. Thank you.